information to help your staff. I love when we see people who are hands-on in the field. Um, I love to see when they join because you're definitely going to learn a lot and hopefully it'll improve whatever you're doing. So, Miss Mohammed, let me know whenever you're ready to get started. I'm happy to jump right in.
Absolutely. So I have disabled the waiting room and it's three after. So I would say let's go ahead and get started.
Awesome. So, welcome in everyone today, and thank you for joining us for our Lunch and Learn. So, today we're going to be talking about launching high needs youth behavioral health services in Virginia in particular. So, during our last webinar, we kind of talked about generally what are some high needs services in states, in United States, for youth behavioral health. But today we're going to talk about Virginia in particular, and it's super interesting. We're passionate about Virginia. And there's a lot of valuable information in regards to what Virginia is needing, the issues they're facing, and how you guys as providers can help with this need. So without further ado, we'll get right in. But before we get started, I do want to let you guys know if this is something you're interested in, we'll be hosting these weekly. And all the services that we'll be talking about today will additionally do a deep dive. So if you enjoy them, stay tuned and hopefully you're able to gain some value from today. So a few disclaimers before we get started. This webinar will be recorded. We do want to make it available for people who aren't able to join us today. So it will be recorded, just so you have that in mind. If you have any questions, we will have a Q&A section at the end. But if it comes to mind, feel free to drop a message in the chat. And during the Q&A section, we'll try to get to it. And yes, hopefully we can answer any questions you may have. During the session, we may ask a few questions, a few polls. Feel free to utilize the chat section and answer them. Again, we want to make it as engaging as possible. And we actually do want to get to know the providers and the people who are in here. So we may ask a few questions. So, a little bit about us at ClearPath Consulting Group, if anyone's new, we have over about 40 years of experience in the human service industry as both providers and consultants. And so we have a focus on being compliant. So, we want our providers to be compliant, not only open their services, but be able to maintain them and be efficient. So, we focus on compliance. And then we also have a tech focus. So we know that it can get really strenuous. There's a lot of things when it comes to navigating licensure and ongoing operations and compliance. So we develop software and we like to be very tech focused when it comes to managing the processes efficiently. And so we help with licensure support. So we help providers get licensed, we help them understand those regulations, we build programs for them. As you can see there, we do the policies and procedures. And then we help with providers with ongoing support. So if you have a business and you need help with maintaining it, different things that play into that. We help providers with that as well. And then we help with support as compliance officers. Again, we're really gung-ho on compliance, 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 compliance. Because we want you to be compliant. We care about the population you're serving because these are very vulnerable populations, regardless if it's mental health, DD, children, adolescents. So we want you to be compliant not only for your business sake, but for the client's sake. And then we do quality assurance planning and support. So we'll help you with maintaining your compliance, maintaining your quality of your program, and continuously improving. So this is about what we do here. We're CHAP certified consultants, and we're really proficient in what we do. So this is just a little bit about our experience, a little overview of the things that we've done here at ClearPath. Again, this is a family-owned business, and we have over 40 years of dedication and experience. So we've opened a range of services. We had an assisted living facility. We've done medical transport, group homes, and even to this day, we're still providers, residential providers. So we know the needs. And we're really excited about today's session in particular because we originated in Virginia. So we know exactly what's needed. We have a lot of experience, and we're excited to share about what we do. So, yes, we're really passionate about the behavioral health industry in particular, especially children and adolescent programs. Just a little bit about your facilitators today. I'll start with myself. My name is Faith Beasley. I'm a certified trauma-informed specialist. I'm also a residential provider at Faith Enlightens Residential Group Homes. We serve adolescent girls aged 12 to 17 that may have various disorders such as anxiety, depression, and self-harming behaviors. I love the children and adolescent space, behavioral health. I'm also a child and adolescent program consultant here at ClearPath. So if you're interested in opening programs serving youth, I'm your go-to person. I'm committed to helping providers and clients. I'm also the founder of Faith Enlightened Self-Love Academy, which we forward self-worth education as a preventative and complementary intervention to existing therapies. So we teach intentionally self-worth. I know that's something that's often assumed. You assumed after a client, in particular a teen or child, goes through necessary therapy or any interventions, you assume that they'll develop self-worth. But it's not often the case, and we found that during our study there at the academy. And so we help residential providers who may serve children. We have plug and play programming that teaches self-worth education. That's what we do there. And I'll open the floor for Miss Mohammed to introduce herself.
Hello and good afternoon. My name is Talia Muhammad, and I am also a CHAP certified consultant here at ClearPath and also a certified clinical manager. My specialty is compliance. So I love the black and white space. I love looking at regulations, developing policies, and particularly the risk management, the quality assurance plans, and also measuring and monitoring compliance. So that's my specialty. And I'm also a lead consultant here at ClearPath Consulting Group. Happy to have you guys here today.
Yes, Miss Mohammed, she's definitely very proficient in what she does. She's very proficient in compliance, and you'll see that we'll learn a little bit about that today, in particular, and what compliance looks like in Virginia. So this is what you can expect for us to go over today. So we're going to talk about Virginia's mental health crisis amongst children and adolescents. So what's going on? What's the stats? We're going to talk about that. And then we're going to talk about what that crisis means for providers. So what they're looking for in providers, what kind of opportunities lie there. We're going to talk about that. And then we're going to talk about some priority behavioral health services in Virginia. Virginia, again, they've been very transparent and open about what their needs are and even what specific services they're looking for in providers. So we'll talk about those services, about what they are. And again, we'll have later deep dive sessions in regards to that. The services that we're going to be talking about that Virginia is prioritizing, we'll later have sessions. So if you're interested in any particular service that we talk about here, look forward to a session that explains further that particular service. And then we're going to talk about how the licensure process looks like in Virginia. If you attended the last webinar, we kind of gave a general overview of the licensure process across the 50 states. And we kind of got that down to a science of what it typically looks like. But today we're going to talk about the specifics of Virginia. So what it looks like in Virginia. And it does vary service by service, but we'll kind of tell you about what you can expect. Excuse me. And then we're going to talk about some common compliance mistakes that we see in providers as consultants in Virginia in particular. There are some common and repeated things that we see, and we want you guys to look out for it if you are an existing provider, if you're a aspiring provider. These are some things you should look out for in Virginia. And then we're going to talk about how we support providers. We have some different ways that meet you where you are. If you need help, we're there to help you. And then towards the end, we'll have a Q&A. So if any questions come up, we'll have a time for that, and hopefully we can answer any questions you have. So Virginia is in a youth mental health crisis. It's one of the states that are in an advanced crisis amongst youth behavioral and mental health. So 1 in 5 children have a diagnosable mental health condition, according to the Department of Behavioral Health and Disabilities in Virginia, this year. But less than half of those children are actually receiving services. So this is a huge crisis. Not only is there a crisis, but only half are receiving those services. Virginia actually ranks 32nd in the nation for youth mental health. So out of the 50 states, they rate 32nd. And they actually ranked 48 when it comes to youth access to mental health services. So there's an issue, there's a huge gap in the people who need the services and the ones who are actually receiving them. And there's a huge gap in what Virginia has available to make access more readily available for this vulnerable population. A study found that 33% of high school students in Virginia report a persistent sadness, and 18% of the middle school students actually repeat, feeling low and depressive almost all of the time. So, this is a really huge need in Virginia, and we're going to talk about why that is. There are a few reasons why Virginia in particular is experiencing this, but there's a high need, there's a crisis, and it needs to be solved. And so Virginia is actively doing efforts, especially in 2026, when it comes to resolving this. So, why is Virginia experiencing this crisis? There's a variety of reasons. We went on an overview in the last webinar of why across the states they're experiencing this, but in Virginia in excuse me, these are some reasons. One, Virginia is still feeling the impact of the COVID-19 pandemic. Actually, a study that was done in 2021, I believe. 22% of adolescents in school reported having suicidal ideation, and 10% actually acted upon those ideations. So they attempted suicide. So COVID-19 had a long-lasting effect. During the adolescence, during COVID-19, those were very vulnerable times for that social isolation to be occurring. It disrupted their academics. And so we're still seeing the effects of that amongst adolescents. Again, lack of access to care. In Virginia, particularly, there is huge gaps in access to care. Only 90% of Virginia localities have enough mental health professionals to meet the needs of the youth. So that lack of access, that lack of preventative care, is really showing in the crisis and the ongoing rates in these crises. So again, that leads into the provider shortage. Virginia has a lot of rural areas where they're miles, hours away from a child and adolescent psychologist, a behavioral health center, a therapist, so that provider shortage is really affecting the children. They're not able to get preventative care. And so the issues are escalating. Only 4 counties in Virginia have sufficient child and adolescent psychologists, and the ratios are outstanding. There's like 14 specialists to 100,000 children in Virginia. So there's a huge need in services. I'm going to talk about the specific services that they need. There's some economic, gender, and racial disparities. Um, there's a lot going on in Virginia. Consider the history of Virginia. So there are disparities in access to care, um, financial ability to receive care. And Virginia is seeing this, and they're actually um, developing efforts to make care more accessible. And again, there's a stigma around mental health care, not only amongst the youth, but around their caregivers, So there we see that a lot in the states of Virginia. We're seeing that. And there's a lack of pediatric training. In Virginia in particular, the most utilized service when it comes to behavioral health care, the front-facing one is primary care providers. So caregivers are saying, hey, my child needs help. They're experiencing this behavior, this mental health condition. And the first people they're going to are hospitals, and they're going to their primary care practitioners. And the pediatricians are saying, hey, we don't have the training to effectively help these children. So we're seeing that this is a result of them not be having access to care. There's not anyone to refer them to, not enough access, not enough resources. The pediatricians are not trained to help effectively. We're seeing a lot of long hospital wait times. So people who are needing, these children who are needing advanced care, they're having to wait significant gaps to receiving their care. And so Virginia is noticing this in particular, and they're actively doing efforts to remediate this. So this is what Virginia is currently working on this year to expand access and reform this. They're really not only trying to get providers, but they want healing. They want to solve this issue holistically. So the 2026 priorities are featuring trauma-informed care. Virginia wants to say that you understand, providers understand the effects of trauma the youth may be facing. So they want trauma-informed care. They want you to consider that when you're developing your services. They want to decriminalize mental health. They're noticing in juvenile detention in correctional facilities that there's often a lot of behavioral health conditions influencing that. So they want to decriminalize. Law enforcement are not equipped to handle these crises that are when they report to certain incidents. So they want to decriminalize mental health and they want to fund the services to support them. Where they're also prioritizing expanding school-based services. That gap, as we saw, less than half of these children who need services are not getting them. They're seeing that and they're saying, hey, we want to meet these children where they are. Where are most children? They're in the schools. So they want to expand access in schools, and they also want to expand access in the community. So not only do they want access to behavioral health centers, hospitals, they want access to services within the community. Because again, the long-term goal is not to institutionalize these children, but they want them to be able to become functional members of society in their communities. So they want services that meet them where they are in the community. We're going to talk about what that looks like for providers and what Virginia is particularly looking for. And something also that they're looking to expand is increasing telehealth access. So they want to make that more billable to Medicaid and more accessible to these students and children. So this is what the Virginia Department of Behavioral Health, this is what the governor is looking for in their initiatives. So that's a general overview of what Virginia is focusing on this year. So, what this means for providers is that there is an urgent need. And so there's expanded Medicaid funding for behavioral health services. Most children in schools, a great percent is dependent on Medicaid. So they're increasing the funding so they're able to get the behavioral health services that they need and have it be billable to Medicaid. So there's a lot of current initiative in expanding of Medicaid funding for these services in Virginia. Virginia is also having priority services. So when we're going to talk about the licensure process a little bit later, but for the services that they're seeing that they need for these youth, they're saying, hey, this is a priority in our state. So the licensure time frame, excuse me, is more shortened. So providers are able to get licensed more quickly as compared to non-priority services. And so that's what we're seeing in Virginia. But it's so important to stress, especially us as consultants, it's our responsibility to stress that this is not just a business opportunity, but it's a commitment, especially in Virginia right now. You're dealing with a highly vulnerable population, and you're going to need to be competent. You're going to need to know their advanced needs. You're going to need to be ethical, and you're going to need to stay compliant, especially in Virginia in particular, because they're increasingly monitoring providers more closely for compliance and quality. And I'll talk a little bit more about that. But yeah, it's a responsibility and it's an opportunity. So these are the focus areas for youth services in Virginia. So they're looking for prevention and crisis intervention. So prevention, they want to prevent these crises from escalating. As I mentioned before, there's the huge gaps between a child going to a hospital for treatment, behavior health reasons. They're finding a huge gap between that initial visit and them actually receiving services. And that gap is causing escalation. So they want more preventative services, more mental health skill building. They want prevention from crises occurring. They want that. So that looks like making care more accessible. We're going to talk about the specifics of that. And they're looking for crisis intervention. I'm going to let you know now, this is something that they're definitely prioritizing, especially this year and the next 3 years in Virginia. They need crisis intervention services. So, more particularly, that looks like mobile crisis services. So, going to meet these youth in their communities, whether it be them at school, whether it be that in their home, and being able to de escalate them from whatever their experience in providing that intervention on site. Again, law enforcement is not equipped to provide these services. So they need providers who are competent, who know the needs, are going to go in there and help intervene on these crises within the community. They're also launching some new services in regards to crisis intervention in Virginia. We're going to talk about in the next slide. So that's very interesting and something that I believe will be very beneficial. And crisis intervention in center-based in residential communities as well is something that they're looking for. So being able to stabilize them, excuse me. And then they're also looking for school and community-based services. Again, they want these youth to become functional members of their society, healthy members of their society. So they want to go into the schools. They want to meet them in their communities, whether that be outpatient, whether that be clinics, whether that be mental health skill building within the home, therapeutic group homes. Community-based services is kind of a wide term, but it's essentially anything that's not within a treatment center or hospital-like setting, but them actually remaining in their communities. So they're really prioritizing that. Another thing that I'm personally noticing as a consultant, Virginia needs transition services. They're finding a great majority of their youth that are aging out of foster care are left to fend for themselves. So they're getting to those ages of 17, 18, where now it's time for them to leave foster care. But they're finding that there's no support for these youth outside of that. So they need providers to step in, and that can look like independent living programs. Step in, help them with housing, help them with those skill building, help them learn how to get employment, how to attend a job interview, how to take care of themselves as a functioning adult, setting appointments, how to pursue higher education. They need providers who are developing these programs and helping this vulnerable population. So transition services is something that I see a lot often that Virginia is needing help with. And then also evidence-based care and trauma-informed care. Virginia, the National Academy of State Health Policy, and also the governor in Virginia had issued, they're seeking evidence-based services. So not only are they looking for providers to come and meet these gaps and serve this population, they want to see your evidence for it. So what is your evidence for the program that you're building? I'll give an example of me at Faith Enlightens. So we serve adolescent girls age 12 to 17 with depression, anxiety, and self-harming behaviors. So when I develop my programming, it's evidence-based. So we base our modalities and programming in mindfulness-based cognitive therapy. Why? We do that because evidence has shown and data has shown that mindfulness-based cognitive therapy interventions has been found to reduce depression symptoms and help remediate. So they want to see the evidence in the programming that you're and the services that you're providing. And this allows for a lot of creativity. So if you're passionate about this population, which I hope you are, it allows you to get really creative, do your research, become more responsible, and say, what is the population I'm serving? And what evidence can I find and build my program off of? So this is something that I really enjoy. If you can't tell, I really enjoy building evidence-based programming. So these are some high needs child and adolescent services in Virginia. So these are some specific services that Virginia has come out and said, hey, we need these services. These are a priority. And so the licensure process has been shortened for these services. And so there are a few more than what's listed here, but these are the ones that we're currently prioritizing here at ClearPath Consulting Group, and that we find is a huge need. So mental health crisis stabilization units for children and adolescents. So this can look like in a center-based setting, so behavioral health center, hospital. They want a unit that can, again, stabilize these children. So whenever they're having a crisis, they want them to be able to go on the unit, receive that treatment that they need, that supervision that they need to help them stabilize and then receive and coordinate their ongoing treatment, whatever that may look like for that particular client. They're also looking for mental health center-based crisis receiving centers. So that typically is residential group homes. So it's typically within the community where children who are experiencing crises are able to get stabilized within their community. So I'm sorry, I don't know if someone said anything, but we will have a time for Q&As. So yes, going within their community in a group home, they're able to get, I believe it's 23-hour supervision and destabilized and be within the community. So not in a hospital setting, but within their community, and that typically is group homes. So they're looking for that. They're looking for both DD and mental health sponsored residential services. So sponsored residential, I like to compare it to similarly to foster care. So sponsored residential would be you as a provider taking responsibility or sponsoring a home, and making sure that the proper staffing, programming, and person-centered care is being provided for a client. So it's different than a group home where you would be facilitating the residential environment. You would be getting a home, you would be staffing the home, and t you would be providing the environment. In sponsored residential, you don't own the home, but you work with a sponsor. So you would be a provider working with a sponsor, and you would be making sure that that home, whatever the child is at, is having the adequate care. They're having the adequate staffing, supervision. They're having the adequate files, and programming, for that child. So it's kind of comparable to foster care, but it's definitely more structured and person-centered. So they're looking for that within the developmental disability community, and with the mental health community in children and adolescents. Something else that is high needs that we're definitely focusing on here in ClearPath, especially this year, is residential therapeutic group homes. So they want group homes for children and adolescents, for mental health. They want them to be able to reside in their communities, but get that advanced care that they need. So there's definitely a need for that, and there's been a need for that for the past few years, I've personally noticed. So we're definitely focusing on that here at ClearPath, for providers. Um, Residential respite, mental health, and DD. Residential respite services are something they need for children and adolescents in Virginia. So residential respite, is a short-term residential service. So it's essentially where a child may be living with their family, whoever their caregivers are, and their caregivers may express a need for a break. So they may be going on vacation or they may just need a break. So respite service is where you're able to provide that, for their caregiver. So the client will be able to come to your residential home, stay and still be able to maintain their treatment, and supervision that they need. So just providing that support for caregivers. Again, Virginia, they don't want to institutionalize these children. They want them to be able to remain with their caregivers, remain in their community. And so residential respite will allow for that, allow for their caregivers to get the support they need while the child is still able to maintain their support that they need as well. So that's something they're looking for. Mobile crisis services. This is a term that I'm seeing so much during my research as a consultant in Virginia in particular. They need multiple crisis services. They need you to be able to go inside the community, meet with these children, de-escalate whatever they may be going through. So they want qualified providers. So we're going to do a deep dive. I believe our next deep dive will be in on this service in particular. So you can be on the lookout for an invite if you're interested in learning more about that. But they need that. So essentially, you would be mobile. You'd be going wherever they are in the community, and whether that be their school, whether that be their home, wherever they're having a crisis, you need to be on call and be able to meet them. So that's a really interesting and highly needed service. In Virginia in particular, if you're on this call, you're kind of ahead of the curve if you don't know already. In July, I believe, they're launching some new services to make mobile crisis services more accessible for children and adolescents. So they're opening another service that is called psychiatric community support, I believe. It's something similar to that, where service providers are able to actually meet them within the school and de-escalate and provide skill building, meet them in their homes. So Virginia, again, they're really prioritizing this. And another one, finally, is substance abuse residential intensity services. So there is a huge opioid crisis amongst children and adolescents in the United States as a whole. But Virginia is particularly seeing this as well. So they're prioritizing substance abuse services, and particularly residential. So helping with that. So again, I know I've just said a lot. We'll have deep dives, but these are in particular the services that Virginia is actively prioritizing, and helping with. So next, we're going to go into how to get licensed in Virginia. We did a brief overview if you were on the last webinar of, again, the licensure process as a whole across the 50 states. But we're going to talk about what that looks like in Virginia in particular. But before we get started, I do want to just, for a quick second, are there any questions or anything regarding Virginia licensure that may hold you back? If you're aspiring to get licensed in Virginia, if you have any questions in regards to getting licensed in Virginia, if there's anything that holds you back about Virginia in particular, I know that the process, depending on the service, can be very complex. I'm interested to know. We love to know from people who are actively seeking licensure. What's something that holds you back about Virginia? So, this is the process about getting licensed in Virginia for child and adolescent behavioral health programs. It does vary a little bit depending on the service. But typically, this is what you can expect of the process. And again, it does vary depending on the service. When we go into later steps, I'll explain the little variations. But first, you want to understand the process. And it starts with you and starts with doing your research. So, step one would be identify the service that you want to open. This is where a lot of providers mess up or aspiring providers mess up because they have an idea, maybe a passion, but the passion of a service that they may have may not be a priority. So we always tell providers, aspiring or existing, when you go to open a service, think about what's actually needed, because you could build a beautiful service, you could have a beautiful idea, but if the service is not needed, then you won't get clients. So think about what's a need, really get into the mindset of a provider of, I want to serve this population, what is needed of them. So choose high priority services that match your bandwidth and experience. So what is your experience? If you're a social worker, what kind of population are you serving? It's always great to piggyback off of your feedback, piggyback off of your experience, excuse me, as a provider or as your professional experience. So after you'd identify the service, hopefully you choose a high priority service. Next, you will identify a high needs geographic area. So Virginia actually does provide the specific counties where the need for particular services are. So we always use that here at ClearPath. So we help our providers identify what actual county they should open up at. So that will be the next step if the state allows that. In particular, in Virginia, they do. So the next will be determining the regulatory body. So once you found the service you want to open, you found the area you want to open it at. Find out who licensed that service. In Virginia, and it does vary here and there, but generally it's going to be the Department of Behavioral Health and Disability Services, for mental health services, behavioral health services. If you're looking to serve the foster care youth, it typically will be Department of Social Services, that will license you. And the process can get a little tricky there. Um, so you really need to do your research because some services, I'll say, for example, independent living programs, you'll need to get licensed as a children's residential facility by the Department of Behavioral Health, but you'll need your independent living program licensed by the Department of Social Services. So you need to really do your research. And then DMAS, Department of Medicaid Assistance Services. Those are typically going to be the regulatory bodies for whatever service you're looking to open with child and adolescent programs. And then the fourth step will be understand the licensure process. Again, each service kind of varies. Some services you need to get a certificate of need. So the process is going to vary depending on the particular services. That's why we are going to do a deep dive if you're interested in opening a service in Virginia or learning more about services in Virginia, because each service has its own process. So you definitely need to do your research. What's needed of you as a provider can vary. So you need to figure out what qualifications do I need? What staff do I need? For most of these services, you're going to need a therapist. You may need a nurse on your staff. You need to have individual policies. The policies vary depending on the service. If you're opening a mental health residential program, the policies are going to vary in regards to that compared to a substance abuse residential. Okay, so you're going to need to understand the variations in the application process. So next would be develop your foundations. These are going to be the core of your service. And I say that because you're going to develop these things, and it's not a one and done. You're going to need to constantly revisit and actually apply these things throughout the duration of your business. So you're going to need to develop your policies and procedures for your service. You're going to need to develop your programming. You're going to need, in Virginia in particular, this is what they're going to expect of you. They're going to want to see your business plan. So what are your plans for your business? What are the scaling? You're going to need to see that. They're going to need to see your financial projections. So you're going to need to calculate that when you submit your application. You're going to need a quality assurance plan. So what is your plan for making sure that your program is effective, that you're constantly improving its quality and upgrading? They're going to want to see that in Virginia in particular when you submit your application. You're also going to need a risk management plan. So how are you going to manage risk? How are you going to protect not only your staff, but your clients? They're going to want to see that in Virginia when you submit your application. And so after you develop those core foundations, you're going to need to select your site. Now, for all of the services in Virginia, for all priority services, you're typically going to need to have a site identified before your application process. And the reason for that is because Virginia has shorter licensing timeframes for priority services. So once they submit your application, depending on the priority service ranking, because Virginia does have rankings, so they'll say priority service one, it's a priority service two. But typically, from submission, within 21 days, you'll have your application reviewed and you'll be scheduled for an initial inspection. So they're going to want to see your site. So if you're thinking about opening a group home, you're going to need to select your group home. Again, like I mentioned in the last webinar, when you're selecting a site, whether it be an office, whether it be a group home, whether it be a clinic, consider the population that you're serving when you develop it. What are their needs? What would make them feel safe in an environment? That ties into trauma-informed care. That ties in with evidence-based treatment. So yes, you need to have that site selected, and the reason for that is you're going to need zoning approval. You're going to need approval from the state that you're licensed and you're able to run a program at that facility or at that office space. You're going to need fire and safety compliance. So you're going to need to submit those things when you apply in Virginia. And again, with non-residential programs, you're typically going to need an office or clinic space. You're going to need to have secure file storage. So after you select your site, you're going to need to hire. Again, for priority services, the goal is that once you submit your application, you're ready to run. Again, because the timeline is so short. So you're going to need to have your staff, whoever your core staff is for your services. You did that research earlier in the process. You know what staffing you need, and so you're going to need to hire them. And for the services we discussed here, you're going to need, of course, a program director. You're most certainly going to need a therapist hired. And you're going to need qualified supervisors, and the specifics of the staff you need vary based on the service that you're providing. So you're going to need to do that research. And then you're going to need to get your background check. So once you hire, it's time to prepare for your application. So you do your background checks. You'll submit your floor plans for your building. And you're going to upload all of that documentation and hopefully get licensed. So once providers get licensed in Virginia, they think that that's the end. They think that once the policies are done, that's the end all be all. But that's not the case. You, your program should be lived in and constantly expanded and improved. And that's just something that Virginia we're not seeing, especially during our experience as consultants. People are not constantly growing, reviewing regulations, providing evidence-based treatment, continuously improving their quality, continuously staying compliant. And so we're seeing a lot of pitfalls in result of that. And so that's why we're kind of changing the way that we're doing things here at ClearPath Consulting Group. We want providers to not only be equipped, but we want them to be competent. We want them to be dedicated, to be real responsible providers. So some common struggles that we see in providers in Virginia in particular is incomplete staff files. Ms. Mohammed, I know that you're experiencing that as well. That's Ms. Mohammed is our she's proficient in compliance. But we're seeing incomplete staff files. So when Virginia is doing their routine inspections of these group homes, of these services, they're finding that the staff files are not in place. We're seeing missing or incomplete client documentation. So when things are on paper, it's easy to have things misplaced. There's not a routine system of maintaining compliance in regards to documentation. So we're seeing with providers we're working with all the time, they're missing that, and so they're actually getting cited when they're getting inspected, which is not good. It really risks your program, and it risks you getting recoupments from Medicaid, where they'll actually come and say, "Hey, we have no documentation that you actually provided the service that you say you're providing. We have no documentation to support that." So they'll actually seek to get the money that they reimbursed you with back. So that's a huge risk that we're seeing that providers are facing. We're seeing a huge lack of understanding of their own policies. So providers are working with consultants. Some are using templates, whatever the case may be, and they're not understanding what's actually in their policies and procedures. So let's say they're opening a mental health group home for children and adolescents, and they have policies for which they have said they'll run their business. But the way that they're actually running it doesn't match what they have on paper because they don't understand the policies. So that's why we've kind of changed the way we do things at ClearPath Consulting Group, and while we established the cohort that is launching this quarter, because we want providers to actually understand. Again, it's a responsibility, especially when you're working with vulnerable populations. You need to understand your policies, and it not only helps the clients that you're serving, but yourself, because they will come and say, "Hey, we need proof that you're doing what you said you would do." And if your actual programming is not in alignment with your policies and procedures, that's a huge issue. So we're seeing that a lot in Virginia in particular. And we see a lack of intake procedures. Again, so when providers are getting licensed, they get licensed, yay, and they think that's the end. But you need intake procedures. Ms. Muhammad is going to talk about what that looks like in Virginia in particular. And so, yeah, we see a lack of that. People are not really sure what to do after they get their first client. And then we also see a failure to stay current with regulatory updates. Virginia is definitely, especially in 2026, seeking to revamp their behavioral health space. And we're finding a lot of the times with our Virginia providers, they're having a hard time staying up to date. You know, there's things constantly changing, constantly regulations are being updated, different things are being revamped. There's a lot coming in 2026 in regards to the revamping of certain services in Virginia and behavioral health space. So we're finding providers are having a hard time staying current. And then we also see in Virginia, they're not opening high needs services, right? Virginia is very transparent about what they need, but we're seeing providers are not launching those services. They're launching services that maybe high needs in another state, but not in the state, not in this state. And then we're also seeing a poor marketing strategy. It's really sad. We see providers who actually built services that they're passionate about, you know, that they really care about, but they don't know how to market it. And in Virginia, marketing is definitely necessary, especially in Virginia. There's a lot of word of mouth. There's a lot of connection building and rapport building when it comes to marketing and getting your service known in Virginia. Again, it's a rural area. It's very old-fashioned in that way of you need to be making yourself known in the community. Not only just having a website online presence, but you need to be actively keeping your services top of mind. So we help with providers with that at our sister company at CCJAM Solutions. So yes, that's some common issues that we see. Ms. Mohammed, I know this is your slide, so I'll let Ms. Mohammed take over. Again, she's proficient in compliance, so I'm excited to hear what she'll have to say today.
Awesome. Good afternoon again, everyone, and thank you so much for joining us. So we'll try to get through this fairly quickly. This, service intake and delivery could use its own webinar, which maybe we'll get to in the future. But right now, we're going to cover the operational backbone of every successful human service business, but particularly youth and adolescent services. So we'll cover assessments, individual planning, ISP development, behavior modification, QA, and then, of course, risk management. Now, if these components are fragmented, inconsistent in any way, your program will struggle. And that's clinically, that's financially, that's operationally, and especially during audits. But if they're structured, if they're standardized, if they're measured, then your program becomes defensible, it becomes scalable, and it becomes high performing. So let's go ahead and start at the beginning. Now, intake starts with program identity first and foremost. Intake does not begin when a referral or when a case manager or service coordinator calls you and sends over a referral package. It starts way before that. It actually starts with your program service plan. And in that program service plan, which is usually developed when we're doing your policy and procedures, we sit down with you and we help you identify who your ideal population is. So you'll see in Virginia some services, like the substance abuse programs, also mental health group homes. It's like a blanket, right? Mental health, substance abuse, that does not give you a persona. A persona is actually a person with specific qualities, tendencies. And so we help you identify the specific personas within that mental health diagnosis, right? In terms of age, in terms of specific diagnoses, we identify that. Also, there are clinical and functional criteria that we have to identify. In addition to that, we have to talk about, okay, what's the exclusion criteria? What, under this umbrella of mental health or substance abuse, what are the personas that you're not going to accept? That might be fire starters. That may be, individuals who are prone to like suicide attempts. That might not be, a persona that you are equipped to service within your program. So we need to identify that. Also required staffing competencies. So after we've identified who those personas are for your target, individual within your program, what are the required qualifications for the staff to actually support them? Also service modalities and expected outcomes. So long story short, if your service identity is vague, your intake process will be inconsistent. And we see this with a lot of new providers, and that, for one, as Faith mentioned, the proper planning isn't there. So they don't really open up a high needs program. And then if they do, specifically in Virginia, maybe they chose a county or area that was saturated with the same type of providers. So even though it is a need in that particular service area, that service is competing. So we see that with new providers, if they don't have a strong intake process, they will kind of be making intake decisions based upon like survival mode. Like, we just really need a client. And then you'll start to see them kind of like relax some of their admission criteria. And that's why planning is so important. So when we properly define the population, we do the proper planning, that's when we eliminate the guesswork. And that's when we can get to that streamlined process in operations. So in this process, you want to always ask yourself, who are we designed to serve? Who are we not designed to serve? What level of acuity can we safely manage? And what supports need to be in place for success? So again, without that clarity, you're going to be risking accepting just kind of any clients into your program, and that's not good for you. And it's definitely not good for the individual, because then we get into compliance issues like quality, and then there are a host of like risk management issues that can lead. Again, poor outcomes, and then regulatory exposure when it comes to like corrective actions. So the intake assessment, it should always be custom to your program and not generic. Here at ClearPath, we love to do customized policy and procedures. We really want to understand you as a provider. We want to get to the heart of your passion and why you want to serve a certain population, so that we can make sure that's expressed in your policy and procedure development, and all of the tools that you'll use. So every organization should have its own intake assessment tool. It should not be a copy formed. It should not be a generic template. Your assessment should align directly with your service model, with your staffing structure, with your clinical capacity, with your program goals. And the purpose of your intake assessment is going to be twofold. For one, of course, you want to determine eligibility and you want to determine whether this individual is appropriate for your program. But those are not the same thing. Someone may technically qualify for your services, but they may not be a good fit or an appropriate fit for your service intensity or staffing model. And so we work with providers to actually give them practical examples of what that looks like, so that you can, again, have that streamlined process. Now, part three is going to be your scoring and decision-making framework. So there should be some type of scoring, or measurable method when you are determining whether an individual is a candidate for your program. So again, that's where that customized form or assessment comes into place. So develop a scoring metrics that evaluates the clinical need level, behavioral risk, medical any medical complexities, support systems, the motivation of the individual to participate in your programming and actually engage. Faith Enlightens Residential Group Home is a great example. In their program, they have behavioral consultation, therapeutic recreation built into their programming. And so the success of their residential program depends on individuals actually being willing and motivated to participate in those in-house group sessions. So that needs to be measured. That's their program, but what your program provides, you need to measure, is there going to be that motivation, that engagement? Also, environmental factors. So you want to create thresholds that will measure whether you're going to accept someone, whether you're going to accept with conditions, or whether you're just going to pass or even refer out. And so that it's going to protect your program. It's going to make sure that you don't have any inappropriate placements. It's going to protect your staff from burnout. I can't tell you how many times I've seen, even when I used to do direct support many, many moons ago, how one client who was inappropriately placed within the program can really they can offset the whole mood of the other residents, of the programming, and they can just be that kind of person that kind of derails that program. So you can reduce that staff burnout and also other client burnout. And then you can reduce the liability exposure, and then you can reduce any adverse audit findings related to providing services outside of your scope. So the intake decisions that you make should never be subjective. They should be very, concrete, defensible. So if one of you, the licensed specialist asks, maybe they're doing an audit, and that's in Virginia, that's very routine. In most states it is, but in Virginia, they start top of the year. They just sent out a memo through the Department of Behavioral Health, letting providers know, hey, expect these unannounced visits. And I've participated in many unannounced visits. And when I tell you they're very thorough, they have a checklist that they check everything from client files to employee files to environmental factors. And they will ask, why did you admit this individual? I've literally seen licensed inspectors take your policy that contains your service plan out and look at your admission criteria, and then look at the client file and look at their face sheet and it not make sense. And you don't want to be in that position. So you want to be able to show the data and a justified decision. And that's why those customized assessments are very important. And then once you have all that, this actually streamlines your ISP development. So ISPs are important, when it comes to being licensed by the Department of Behavioral Health. They're individualized service plans. And so every individual receiving services through that department has to have one. And so once someone is actually identified as an appropriate candidate, the next phase will be able to move forward very systematically, very streamlined, right? There should be a tight workflow in place because all you're going to be doing is extracting the assessment findings and you're going to convert the identified needs of that individuals their and their goals into measurable outcomes for them, and then those should automatically align with your program goals and your program services. So you don't have to create a new service line because you appropriately or inappropriately admitted someone into your program. And then you'll be able to assign responsible staff, and again, establish timeframes with metrics. So if your intake assessment is well designed, your ISP development shouldn't feel like you're starting from scratch. It should actually be like you've kind of like pre-done your ISP for that individual by just assessing whether they were a good fit for your program. So it should definitely be structured. And then something else to just keep in mind is that layering services within your program is critical. If your target population, which we just discussed, Faith beautifully discussed all the high needs services in Virginia in particular, and we know for youth and adolescent services, they have behavioral health needs, medical needs, vocational needs, and family engagement needs. So you want to make sure that your programming, whether you're doing residential support or whether you're doing mobile crisis or whatever you're doing, that you have identified your particular population and either you have several services within your core service to where you can provide like holistic supports, or you have contracts with other providers in place that you can get your individual the supports that they need. So again, that's going to reduce delays in service implementation and ISP development because you're again have properly identified that particular persona and you've admitted that particular persona into your program. So then part 5 is going to be your behavior modification plans. And we're coming up, it's almost 2 p.m. and I think that this session ends at 2. So I'll kind of speed it up for those of you who can hang on. If you could give me maybe 10 more minutes of your time. But again, this could be a whole nother webinar by itself, but behavior modification plans, if your organization directly provides behavior intervention services, again, you're going to need that standardized development protocol. You're going to need defined data collection tools. And again, you're going to need review timelines, staff training procedures, and your behavior plan should include like operational definitions of behaviors, replacement behaviors, reinforcement strategies, crisis procedures, data tracking methods. If you don't create behavior modification plans because of your program type, and those will be created by another provider, you still carry responsibility because most of the time, if you're like a residential provider, you'll be responsible for working across a interdisciplinary team and implementing while that individual is at home certain parts of their behavior modification plan. So that pours into making sure that your staff is able to be trained thoroughly and quickly on those outside plans. They are able to document, they're able to monitor, and you're able to monitor, and then you're able to track progress data and communicate with whoever the plan author is about the effectiveness of that plan. So with quality assurance, that's the next one. We definitely want to always make sure that we're spot on with quality. Quality should never be vague. It should be defined and it should be measurable across three or more areas, but these are my top three. So staff level quality, client level quality, and then program level quality. For the sake of time, I won't deep dive into those, but again, measurable outcomes in each one of those areas. And then risk management, identifying and measuring exposure. So, every program, depending on your type, risk looks different depending on your, again, program type. You're going to have certain business risk because of that. You're going to have certain staff risk. You're going to have certain client risk. And you should have risk indicators tracked all across your programming. So everything from your daily logs to your weekly supervisory reviews, to your monthly compliance, your quarterly, your annual risk assessment, all of that has to be written into your program. And that's where ClearPath comes into place. So if we could kindly go to the next slide, and I'll try to wrap this up really quickly. So this is just a recap, about the assessment and individualized planning and how important it is for youth programming. And we can move forward. All right, so key compliance drivers, and we can kind of just pull all of them up because I'll go over them really quickly. But with your key compliance drivers, they encompass all of your quality and risk management, starting from, again, your policy and procedure development. You want to make sure that your policies are, again, specific to your program type, aligned with your target population, reflective of your staffing model, written in plain, actionable language. And then, of course, compliant with your federal, state regulations. If you're receiving Medicaid funding, which most of these youth and adolescent programmings do, their waiver funding with DMAS. So you're going to be making sure that you meet the Medicaid conditions of participation for that program. And then if you have a program that's the license is accreditation based, then whatever accreditation standards. And just so I can kind of make the most of the time, someone asked in the chat, does VA require accreditation by CARF or JCO? And the answer would be yes, especially for your substance abuse programs. Now, it's not required for like 2.1. It's not required for some of those programs, but if you do have them, then you can circumvent the state licensure process, if that makes sense. So it's different than in Maryland, where you do for your substance abuse and your therapeutic recreation, therapeutic group homes. You do have to have, those are accreditation-based licenses. In Virginia, no, it's not like that.
I
But
do want to, oh, sorry.
yes, please go ahead.
I do want to jump in that we will have a webinar replay. So we're going to go through the rest of the slides. We just have a lot of information for you guys. But if you aren't able to stay throughout the duration of the time, we will send you out a replay tonight. So you can look forward to that. Excuse me, Miss Mohammed. I just wanted to let everyone know who may be wondering. We will have a replay if you're not able to stay.
Awesome. Awesome. Okay, so that takes a little bit of pressure off me because I'm kind of speeding through this. But yeah, so again, policy and procedure development, that's where it starts there. Your staff, when they look at the policies and procedures, they should be able to read it and know exactly what actions to take. So even myself as a consultant, I am, when you do policy and procedure, you want to be wordy, you want to be thorough, and especially I'm a home health consultant and home care. And so those policies and procedures, usually you do have to be like accredited, especially if you're, moving into the home health space. And so they do like more longer like policy and procedures. But what I'm noticing is that with a lot of the youth development programs, especially residential in specific states like Maryland, those that are licensed under the DDA, and then Virginia, the Virginia Department of Behavior Health, they like those policies and procedures to be very actionable, literally like the policy and then the procedures, do this, do this, do this, do that. like. And that way, that is like your SOPs, right? Because a staff, even newly hired, if they are responsible for a process or workflow within your organization, then they can just open up the policy manual and have like the step-by-step instructions. So that's what your policies and procedures should be like. This is going to be your first line of defense in risk management, making sure people know what to do and how to do it plainly, clearly. And then compliance, leadership, and oversight. I'm seeing that this is a major deficiency across all program types, adults, children, home health to residential, right? And that every organization should designate a chief compliance officer. In smaller organizations, this is going to be looking like your executive director or your program director having this dual role. But it's important that even if this is someone carrying out this role that has another title, they should still have a written job description with defined authority, defined responsibilities, access to leadership, and oversight of the quality and risk process. So their compliance responsibilities, again, should be clearly defined, but it should include like monitoring regulatory updates, like Faith mentioned. In Virginia, I mean, it seems like almost weekly, if not multiple times a week, they put out these memos through the Department of Behavioral Health about different things that's being updated, whether that's reducing regulations or upcoming inspections or a different way or more tools to monitor risk or whatever it is. They are constantly pushing information. And in Maryland, which is another one of our states that we work in regularly. The DDA does that as well, but they do that mainly through their town hall meetings where you get to sit in, you can hear from the, individuals receiving services, and then you can hear updates from the DDA as well. But monitoring those updates that compliance officers should be responsible for, reviewing incident trends, overseeing corrective action plans, leading internal audits, whether that's weekly, it should be weekly, monthly, quarterly, and yearly, and then reporting to leadership. Also, every organization should have a quality and or compliance committee. And that committee, again, should have a defined membership structure. They should have a scheduled meeting frequency that's actually kept, formal agendas, data review tools, documented meetings, and action tracking laws. So compliance leadership without structure, it just becomes symbolic. If you write about quality and all the meetings and risk management, but you never use the tools and you don't implement it, it just becomes like it's symbolic in your organization. And that, can lead to issues with, again, not protecting the staff, safety issues amongst clients, you know, jeopardizing funding through recoupments, and then also jeopardizing licensure. Also, training and education. Compliance cannot exist without training your staff properly. Both executive leadership and your direct support staff have to be trained on policies and procedures, documentation standards, regulatory requirements, program expectations, and ethical conduct. The training should be structured, it should be scheduled, it should be documented, and it should be evaluated. So you should have some kind of quizzing or scoring there. And then it's something to keep in mind that this is a critical point. Your training is not just for the sake of training and having your employee files up to date, but your compliance and quality data should guide a lot of your training too. So if your documentations, audits, they reveal like recurrent errors, then maybe for that month, there needs to be a retrain on documentation. If incident trends increase, then that indicates maybe we need retraining on de-escalation and crisis response. If corrective actions repeat, then we need to train on compliance. Again, training should not be random. It should be data driven. And records of training must be audit ready at all time. And then effective lines of communication. So again, you know, there should be communication throughout your organization, and not just thinking about staff and administrators. I'm talking client and family, or individual and family level as well. There needs to be regular and consistent and concise lines of communication, right? Whether that looks like putting out newsletters, depending on how often your big your organization is, whether that is sending like a monthly newsletter to families, letting them know about events, keeping your website updated with pictures and slideshows, whatever that looks like for your organization type. Also, there needs to be effective lines of communication when it comes to resolving internal audits and corrective actions events. So you want to make sure you have tools there in order to effectively communicate. And then last but not least, enforcing standards of compliance. So policies without enforcements are just suggestions. Client compliance always has to be reinforced. So this is going to include like your corrective action process, performance evaluations that are tied to compliance metrics, disciplinary processes when necessary, and then of course positive reinforcement. So recognition for high quality performance, like if there are certain quality metrics within the program that the DSPs are required to like meet every week, every month, like reinforce them positively for actually meeting that. That's going to ensure that the organizational's quality metrics and goals are implemented. So again, you can incentivize. So for timely documentation, zero audit findings, reduce incident trends, training completion rates, ISP goal progression, that can be rewarded on a client level basis. So even within, you developing client ISPs and behavior modification plans, have some type of rewards and consequences tied to those plans, so that even on the client level, they can feel incentivized. And again, all of that data ties into your quality and also prevents and reduces risk. So again, compliance should be performance driven, and it shouldn't feel punitive. It should definitely feel like it's rewarded. And when staff and also the individuals within your program see that their compliance is connected to recognition, it's connected to growth and program success, the engagement increases. Then you get that buy-in all across the board where they have an invested interest for doing their best, whether it's as a staff person or an individual in your program, for participating and meeting those goals. So if we could go to the next slide. So the clear pathway, we are here to help you build sustainable youth programs. So starting from your program development, making sure that your policies and procedures are aligned, making sure that we layer programming inside so you can provide holistic supports, or even helping you connect with other service providers. We do that in that process. And then once we have a strong program developed, helping you with licensure assistance, that looks like helping you gather all the documentation and organizing that, submitting it for you. In Virginia, you submit your application through the Connect portal, which we love. So, you create the account, we guide you on that, and then we can go in and upload all of your documents, your policy and procedures, your job descriptions, and all of that. We can kind of monitor the licensure process from that portal along with you. And then once you're licensed, we can then provide operational support and also compliance monitoring, helping you with that, and then helping you just grow, helping you with strategic planning to open up other programs or other services within the existing program to increase funding and also supports for the individuals. And if we could go, okay, awesome. So how we do that is we have, and Oh, sorry. I updated the live slide with this, but we have a tool. It's called Mountain View Compliance. And I'm sorry that my graphic doesn't show here, but with Mountain View Compliance, we place those compliance tools in your hand. So everything from HR, you can onboard your employees, you can put their staff training, videos, quizzes inside of that. Your employees get their own portal. They can go in, we gamify their training modules so they can see, where they compare to other staff within the programs. And you can use that data to incentivize them for keeping up with their staff training. We also have quality assurance modules that can be completely customized for your program type. We have compliance modules with a dashboard. So at any given time, even if you have 10 programs and they're all different, you have mobile crisis response, you might have residential, you might have adult programs, you can toggle between your programs and see a nicely displayed compliance dashboard and see at any given time how your program is doing. We also have client file, so a EMR where you can store your client file documents. We are rolling out some awesome tools like an ISP generator, behavior modification plan generator that's specific to our clients' program types, marketing suite. So if you want to get a demo of what we provide here through our software, Mountain View Compliance, we do weekly webinars just like this every Wednesday at 12 noon, and you can get a sneak peek to see exactly what we do here at ClearPath and how we can support your program.
All right, thank you, Ms. Mohammed, for that.
You're
That
welcome.
is so important. Compliance. Like I said earlier, at ClearPath, we're compliance, compliance, compliance because it is so important to maintaining your program as well as launching it and scaling it. So you need to be compliant. So hopefully everyone gained a lot of value from that section. But now that you know the need in Virginia, you know the behavioral health needs, you know the services that they're looking for, you know the process, um, we want to provide you two ways forward. So if you're seeking assistance with getting licensed, maybe you're an existing provider, maybe you're an aspiring provider, this is essentially the two ways that we help. And so one, we have the do-it-yourself cohort intensive. So that is learning. It's essentially a do-it-yourself program, which we help providers develop youth behavior health programs and help them with the path of getting licensed. So I'll explain a little bit further about what that looks like. But it's for people who are looking to learn for themselves. And then we also have the Done For You program development and consulting. So we'll assist you with everything that's needed within the process. We know that it can get really difficult to do the research, to look at the regulations, to kind of figure it out yourself. So these are two options for people who they want to get licensed. They have goals, they have ideas for businesses and services they want to provide, but they want that guided expertise. And so then we can help you through either of these ways, and I'll explain it a little bit more. So the do-it-yourself intensive cohort, we just launched that this year. It's just because of the things that we've been seeing. I know that said a little bit earlier about kind of the common issues that we see amongst providers. And a huge one is that providers aren't understanding their own policies. They're not really understanding what they're intended to provide. And so we want to provide more of a guided experience for providers who want to learn how to get licensed themselves, but you want kind of a guided oversight. And also you get a like-minded community of other providers who seek to provide services in youth behavioral health. So we'll teach you how to understand regulations. We'll teach you how to build policies using the systems that we have here at ClearPath. So that should be interesting. And then we'll teach you how to develop compliance systems. So how to maintain compliance as you're doing it and navigating this space. And we'll also teach you how to prepare for inspections. So the ultimate goal of this cohort, if there was a course on how to become a behavioral health provider, a youth behavioral health provider, this is the course for you. So the goal is to develop competent and sustainable providers. And so the cohort is limited. I think we're only accepting about 25 providers. So if this is something you're interested in, we can definitely assist you with that and something you should apply for. So this is who the typical candidate for the cohort is. It can be existing youth behavioral health providers. So if you're already a provider and you just want to learn how to pursue licensure yourself, you want to learn how to develop policies yourself. Maybe you don't want to always be dependent on a consultant. So this is for you if that fits the bill for you. This is also for aspiring providers. Maybe you're new to the behavior health space. Maybe you've never been a provider before, but you want an accessible way to learn how to get licensed. Again, the done for you package, it's a little bit more, not, it's more expensive because you're essentially getting everything done for you. But if you want to learn and you want to jump into the field and you want more of an accessible entry price, this is something that could be for you. You'll gain a skill. This is also for existing professionals, social workers, support coordinators, therapists. Maybe you have a passion for youth behavioral and mental health, and you want to one day open your own service and business. This is for you. You'll learn, and you'll learn how to do it all by yourself with guided expertise. So this is just an overview of what you'll learn in the do-it-yourself intensive cohort. It does start February the 24th. And so you'll learn how to register your business. So your LLC, get your EIN, your NPI number. You'll learn how to use Mountain View Compliance, and you'll get free access of that compliance tool that Miss Mohammed just spoke about for 1 year. Extremely valuable. You'll have a fully developed policy and procedure manual for your new business. You'll have developed a QA, risk management plan, and you'll have a premium marketing kit. So we do express how valuable and important marketing is. I spoke about it a little bit earlier. So you'll have a website. We'll teach you how to do that. We'll teach you how to do a brochure, business cards, and a flyer. So as soon as you get licensed, you're able to hit the ground running with marketing. And we actually have a module and a tool with inside of Mountain View Compliance that makes developing those things so easy. So it's super exciting. And you'll have oversight. Me and Miss Mohammed are two of the consultants that will be monitoring and guiding you all throughout that process. So we're really looking forward to meeting these providers, helping them, and developing a community. You know, you're not in it alone. So it'll include bi-weekly meetings. So we'll meet twice a week, and we'll do policy to procedure development. We'll do guided workshops. And so you're not alone doing this. You're getting that expertise and you're setting yourself up for success. And so the early bird pricing for that has expired. It did expire on the 7th. But for $5,000, that you can get you a slot on the intensive cohort. And again, we have been seeing a lot of expressed interest in the cohort. So we're excited to get in and meet you all. And there is a limit of 25 providers. And we really want dedicated and focused providers who are willing to get into, put in the work. So we do have a done for you option for professionals and providers who do want everything done for them. So you'll essentially get everything that's needed to go ahead and pursue licensure. So we'll do all of your policies and procedures, your QA, your risk management plan. We'll do your business plan, financials, your marketing plan. Everything that was detailed that we said that you need on that path to licensure, we'll do it for you, and we'll collaborate with you. This package also includes a 5-page website, a flyer, brochure, and business cards because we understand the importance of marketing. Again, you need that. So we'll develop those things for you. And then it also features 3 months of marketing via CCJM Solutions. That's our sister company that we partner with to do marketing services. So we have a referral marketing program in which we actually help providers market within their community their services. And so they've been really successful with that at CCJM Solutions. And then you also get a year of Mountain View compliance for free. And that also includes 30-minute meetings with your consultant. So on those meetings, you'll just be strategizing. They'll be getting information about your service, what you're looking to provide. And then the two other meetings to just give you updates on what's going on and what to expect. Well, we like to use a collaborative model. Again, we want providers to be actively involved in this process. So you'll be able to work alongside your consultant and see them as they're making your policies, make comments. And on those calls, you guys can kind of get on the same page and you can really be hands-on in this process. And so pricing for that is 12,500, and that's for all of these priority services that we listed today. So the ideal person for the done for you package is for a variety of people. Maybe you're a busy professional. You don't have time to research all of those regulations and figure out the policies and navigate all the specific licensure pathways. So if that fits who you are, this is for you. It's for new providers. Maybe you just want hand-holding and expert guidance. We can assist you. It's for new providers. Maybe entrepreneurs who are entering the behavioral health space who really just need advanced help. This is for you. And so it's for organizations. Maybe you're an existing organization. Maybe you have businesses in other states in the behavioral health space and you want to scale. The Done For You package is perfect. You're busy, you don't have time. The Done For You package is essentially a business in a box. And so this is also for leaders who want expert oversight. You want oversight throughout this licensure process. You don't feel like having those costly delays. This is for you. And so we're just letting you know about the limited slots. We've experienced a high volume of interest in particularly children and adolescent behavior health programs. And so we do have to limit the amount of people we are accepting because again, we like to do hands-on-hand expert guidance. We like your policies to be tailored. We're just not out here trying to produce a bunch of services that aren't compliant, that aren't effective. So we do like to be very selective and maintain the quality of our services. So for the cohort, we're only accepting 25 providers this cohort. We do plan to do the cohorts quarterly, but we're not sure when the next one will be. So if you're interested, that seems like something you would be interested in, I would definitely suggest applying as soon as possible. And we're only accepting 10 providers for the Done For You package a month. And that's just what we're saying overview, but um, we're seeing an advanced interest for the Done For You package as well. So we're limiting that to 10 providers a month. So if you are interested, you want to get started soon, I would definitely suggest you guys get started as soon as possible because we're seeing an advanced need, advanced interest in providers, and we don't want to sacrifice any quality. And this is just a tentative schedule for the cohort if that's something that interests you. The cap applications are open. I think it should be in the chat, so you can apply. Again, we're seeking passionate and responsible providers. So will you submit your application, and then the application deadline is February the 20th. Now, this is tentative. We may extend. We'll let you know by the end of the week. But this is the tentative schedule for right now. The application deadline would be on the 20th, and then the 24th is when the cohort will begin. We'll start our guided sessions, our weekly sessions. We'll meet everyone, and hopefully it'll be a very valuable and educational experience for everyone. I'm super excited. And then April the 16th is the last session of the cohort. Again, stay on the lookout if that's something that interests you. Submit an application. You'll get all of the updates. We look forward. And at the end of the cohort, we hope to provide immense value and put you on the proper path to being a licensed provider. Now, you guys have made it to the end. For those who are here, if you have questions, feel free to have. I know some people have said some things in the chat. We're going to revisit those. So yes, any questions that you have about anything that we've spoken about today, please feel free to ask them and hopefully we can answer them. And Miss Mohammed, I'm not able to see the chat. So if you see anything in the chat, um,
Not just yet, but I did want to mention that, sometimes questions come a little bit later. So you're always welcome to email us, and I'll put our email here in the chat. And you are also welcome to schedule a free 15-minute consultation. Happy to meet with you.
Yes. Yes, feel free to send us an email at hello@ClearPath Consulting Group. If you have any particular questions in regards to children and adolescent programming, I'm always here. You can shoot me an email at faith@ClearPathConsultingGroup.com. I'm happy to answer any questions. I did see something come in. Was that the link? That our email link?
Yes, and I just added yours to the chat as well.
Thank you so much.
You're
I'm
welcome.
just making sure there wasn't any previous questions. Okay, the last question you did answer. All right. Well, thank you guys so much for joining us today. For those who are still here, I know it was a long one. I do think in the future we will extend it to maybe around 1:30, so an hour and 30 minutes, just because we have so much value to give, a lot of information. So it requires a little bit of time. So hopefully you guys gained a lot of value from today's session. Again, be on the lookout. We're always having these weekly. So if you have any questions, feel free to shoot us an email. Again, register for the cohort. If you're interested in a done for you service, you should get started as soon as possible. Slots are filling up for this month. And so, yeah, thank you guys so much. Ms. Mohammed, if you had anything else to add, we can go ahead and wrap it up today.
Nope. Thanks everybody for joining, and we will see you soon.
Bye bye. Be on the lookout for the webinar replay.